even faster and do really high quality research so that can inform our guidance.
Thank you, Maria, and for explaining as well all the efforts that you, Dr. Mike Ryan, and Director General and other experts are putting as well to inform public timely on everything we know and we still need to learn about. So, Dr. Mike Ryan, how does your day look like as WHO Chief of Emergencies?
What she said. No, it's obviously the same kind of diversity. I think so many of our staff have been working 7 days a week for 7 months. So there is the day you plan and then there's the day you have. I think we all know that one, right? Today will be a fairly typical day, you know, starting with the morning meetings, but then I would have gone in to meet Walid Obidat, the ambassador from Jordan, and then straight into a global teleconference on the Solidarity Fund, because we've received over $215 million through the UN the Solidarity Fund for COVID-19. Thank you all. And many of you out there have made contributions to that, both individual citizens and private sector donors, and it's made a huge difference. And that's allowed us to invest in research, it's allowed us to invest in protecting refugees through HCR, it's allowed us to invest in research and development, it's allowed us to invest in training and so many other things, and it's really added value. And we have to meet every week to go through how those projects are going, how the money is being spent, just to ensure that we're getting good value for money for all of you who took out your precious dollars and yen and won and euros and shillings and everything else to support this. But then, and I think that's probably the biggest challenge, is the shifting your brain between things. It's a bit like those of you who are watching who were in secondary school. You know, it's like going from geography class to maths class to English class and then religion class or whatever else it is, and your brain is, by the mid-afternoon, you don't know where you are. I went straight in after that to a global meeting on contact tracing and how we work on that, and I'm also the chair of the UN Crisis Management Team, so we have 23 UN organizations working together. We meet again on a weekly basis. I chair that, and today we were discussing the Access to COVID Tools Accelerator. We were discussing the new policies from the UN agencies on schools reopening, and we were discussing the preparations for the next G20 meeting on global preparedness. So, and then into a meeting preparing for the IHR Emergency Committee, which is happening on Friday, and then another teleconference with some logistics experts from around the world, looking at how we're going to be able to scale up our supply chain in the coming months, because we're going from supplying millions of diagnostic kits to potentially hundreds of millions of diagnostic kits. We're going from having no COVID vaccine to potentially having 2 or 3 billion doses of vaccine. We've got to be able to buy that, ship it, move it safely, and we need to start planning for that now. So that was my day, and I'm here now.
Thank you very much. Thank you very much for your time. I would just like to stress that COVID is not the only emergency that you are overseeing and the WHO is responding to. We still have Ebola in DRC and other humanitarian crises. So I'm sure you have a lot more meetings on these emergencies as well.
I was just giving you the COVID ones.
The COVID ones, yes.
We can do the Libya one, and we can do the Syria one, and the Yemen one. And I think it's a very good point, Alex, because we cannot forget that there are literally hundreds of millions of people around the world who are, you know, already suffering huge issues of food insecurity, conflict, lack of access to health services, and we have to keep our eye on ensuring that we continue to serve them. Yeah, you're right.
Thank you, Mike. You also mentioned IHR, International Health Regulations, and the Emergency Committee that meets on Friday. But tomorrow we are marking six months since we declare public health emergency of international concern. That's the highest alarm that WHO can raise for emergency. How do we raise that alarm, and why does it matter?
The international health regulations is, in a sense, is the international law around epidemics and emergencies, and it was entirely revised in in 2005. It took 3 years. Governments from all around the world, and people say that the WHO and IHR are the same. Well, in fact, the IHR was negotiated by our member states. 194 countries came together and they said, okay, how are we going to manage epidemics together, and what are the rules going to be? And they spent 3 years negotiating that. It came into force in 2007, and it's been 13 years that we've had this new and revised IHR. But we've only declared 4 public health emergencies, global public health emergencies, in that time. So it shows you that the WHO doesn't declare global public health emergencies every day. Where we have, right now, today, we have 33 emergencies around the world, but they're operational emergencies, things that are bad, and they require us to respond, but they're not considered by the global community as global public health emergencies that require this collective action at global level. The first one that met those criteria was the pandemic of 2009. And I think that's the essence of the IHR, is when the IHR Emergency Committee gets together, and that is selected from a whole series of representatives that are suggested by our member states. They get together, we brief them on the existing emergency. They come to a determination of whether that event meets the criteria that represent a global public health emergency, and they advise the Director General of that. And on the 30th of January, they declared, they advised the DG that this was a global public health emergency. And in that sense, that's a call to action, because that's essentially saying to the world, this was an emergency, but now we are giving this a completely different status. We are saying collectively, globally, this represents a threat to the world. And in that sense, it should generate, and it has in the past generated, a massive response. I think in this case, we did see a response to the declaration on January 30th, but I'd have to say that the overall response to that massive alert was less than it should have been overall. And I think we all need to look at that. Why did the world react strongly enough to that declaration on January the 30th? And did we lose time in scaling up the response at that moment? At that time, I think we had 100 cases, less than 100 cases outside China, and no deaths. Can you imagine if I say we'd less than 100 cases outside China and no deaths, and then where we are now? So we really do have to look at the opportunities that were lost potentially in suppressing the disease over time, and we all have to look at that very carefully. But the IHR itself is an important instrument. It's an important way for countries to agree. The other thing I think in the IHR is that a lot of the international health regulations is about preparedness and about getting countries ready. And it's within the IHR, there are commitments from each country to say how they're going to improve their system. And I think another lesson from this pandemic is that not all countries were ready. In fact, very few countries were really ready to deal with this scale of an emergency. So when this is over, and I'm sure it will be over, we're going to have to sit down and not only look at how do we work together internationally in coordinating response, but how do governments prepare. And I've said this before, we spend a lot of time protecting our borders from invading armies. Maybe we need to spend a bit more time learning how to prepare our health systems and others for epidemics.
Can I say something on that? Just to say that I think that in the beginning, especially with this declaration of this public health emergency of international concern, which is the highest alert we can raise under international law, as Mike has said, we did see some countries, I agree, we need to really strongly look at how countries have responded to that and how they responded to this pandemic. But I do think that in some countries, the ones that I think had direct experience with SARS, yes, the first SARS, countries that had experience with avian influenza outbreaks, countries that had experience with MERS, and even countries across Africa that have experience with other infectious disease outbreaks, they were in a better state of readiness for something like COVID than many other countries, including high-income countries. And I think that the countries that had that experience, almost that trauma of dealing with something like SARS in 2003, knew how serious this was immediately. And so those that acted really fast, acted really aggressively, took a really serious look and approach to it, fared better in the beginning. But again, there's a lot to learn. I get a lot of questions right now on the 6 months, six months, 7 months in. The biggest question that I have is, are we going to learn enough? Is the world going to learn enough to make changes? And I'm really hopeful that countries will use this as an opportunity to build back better and be better prepared and ready for when and if this happens again.
Thank you very much. I think this was very helpful for all our viewers to explain how the IHR works and how we can declare a global emergency. I think it's worth as well repeating, as we've been consistent in our recommendations, what all of us can do to stop the spread of this virus. So I think it's worth mentioning as well, what are the measures on individual level that we can also take to support the response?
Yeah, so I think there's a lot that people can do, and I think everyone really needs to understand that they have a role to play. I say this a lot, and I will continue to say this, because we need everyone on the planet to understand that you have a role to play. Whether you are an adult, whether you are a child, regardless of where you live and whatever type of situation that you're in, you have a role to play. It starts with the basics. It starts with the hand hygiene. Clean your hands where you can, when you can, with soap and water, with whatever means you have, with alcohol-based rub. Physical distancing, so at least 1 meter apart, and this is, at least 3.5 feet for those of you who don't use the metric system, to practice respiratory etiquette. So that means cough or sneeze into your elbow. It means wearing a mask where appropriate. There are specific settings where we encourage the use of a mask, where you cannot do physical distancing, where the virus is present. It includes staying home if you're unwell, contacting the hotline, contacting your medical provider to ask, what should you do? Should I get a test? It means adhering to the recommendations where you live. So in situations in certain countries, you're asked to wear a mask, you're asked to stay home, you're asked to follow certain rules. Please do so, because that will help break chains of transmission. And it means get involved. Find different creative ways in which you can support the response by helping, checking in on a loved one, checking in on someone. Keep yourself physically distanced, but just check in on people. We have to acknowledge that this not only has an impact on our physical health, but it also has an impact on our mental health. And there are many people that are feeling alone. There are many people that are feeling scared. So there's ways we can be kind to one another and help. And then there's a whole slew of activities that governments need to do and leaders need to do, and I think we've outlined those before. But individuals, really, please be informed, be alert, be aware, find good sources of information.
Thank you very much, Maria. There's a lot of questions coming in from our viewers, and we are very grateful. I'll start with this one from Twitter. Although many are taking precautions like mask wearing and physical distance and also the lockdown measures, still the virus is spreading. Why?
Well, there's lots of reasons I think that the virus is spreading, but the virus likes people. It needs people to pass between. And so where we see transmission occurring, it's between people who are in close contact with one another. In many countries that have had success in bringing the outbreaks under control, they're starting to see some resurgence. They're starting to see some outbreaks. And many of these outbreaks are happening in specific settings. So, for example, we've seen some outbreaks occurring in nightclubs. We've seen some outbreaks occurring related to bars and restaurants, in terms of long-term living facilities. So if the virus has an opportunity to enter those types of situations where you have people coming into contact with one or very close contact with one another, not practicing the hygiene measures and the physical distancing measures and the mask wearing measures that are needed, it will pass between each other. We should not allow this virus to transmit between people, and we have some control over that.
Thank you, Maria. Here's another question coming from a Facebook viewer. Why does some national health agencies recommend for people to be 6 feet apart? We just mentioned WHO recommends at least meter or 3.5 feet.
So we recommend at least 1 meter, which is the 3.5, and it says at least. So the longer, the further, the better, if that could be done. What we've done is we've been working with a number of scientists across the globe on looking at the distance, looking at how far these droplets will come out of an individual's mouth. We know that physical distancing works. And in situations where you can't do physical distancing, we recommend the use of a fabric mask. And I should take an opportunity to say that these fabric masks, not all of them are the same. We recommend fabric masks that have at least 3 layers and have this filtration layer in between, an absorbent layer in the beginning and a repelling layer on the outside. So it's a combination of factors that we need. Physical distancing alone doesn't work, masks alone don't work. All of these measures need to be used at once.
Thank you very much, Maria. Mike, we are receiving a lot of questions about hydroxychloroquine and its use in treating COVID-19 patients. What do we know about its effects?
Well, I think the many drugs have been tried in this case, and there's been a lot of repurposing of a number of different therapeutic agents from uses in others. And in fact, we've had hydroxychloroquine as part of our solidarity trials, as have other big trials around the world. What is clear is that while there have been some observations in smaller studies and observational studies that indicated some positive impact, all of the large studies that have been done so far, the ones that have been controlled, randomized trials, have not demonstrated a positive outcome or an improvement in using hydroxychloroquine in ill patients in terms of improving their outcome. What's still under study is the use of hydroxychloroquine as a prophylactic, as a drug to potentially reduce the chances of you getting sick if you've been exposed or if you've got mild infection. And we're still waiting for final results on that. But I think it is clear that the overwhelming medical evidence is that hydroxychloroquine, based on the science and based on the published evidence, does not show a significant impact in improving the outcomes for patients with confirmed COVID-19. But we continue to look. We've seen dexamethasone and other drugs show some positive effect, and we will continue to keep open mind. But what we do have to do is to do the biggest studies we can in the most controlled way and give the best information that we can to people. And many independent agencies around the world have come to that same conclusion. And the other thing we need to be careful with is, like with all drugs or most drugs, they can have side effects. And certainly hydroxychloroquine is associated with potentially significant side effects and should only ever be taken, especially in the context of COVID-19, under medical supervision. And it is still obviously the right of any physician to prescribe a drug for an indicated drug for their patient according to national laws and national guidance. But all we can say is that at this stage it does not appear that hydroxychloroquine has a benefit in the treatment of sick patients with COVID-19.
That goes to your first question that you asked about the science and the speed of the science. I mean, what Mike was describing, these are randomized controlled trials that are happening in the context of a pandemic. And it's really incredible that these high quality studies are being done and that these results are being available so quickly, because we can answer questions. This one may not have the positive outcome that we would hope for, but still, I mean, the science is happening incredibly fast. And it's just an example of the speed at which these results are coming out.
Yeah, this was a great one. I'll take another question from our viewer, I think on Facebook. How long a COVID patient remain contagious? Any difference between mild, moderate patients and severe critical patients in terms of duration of transmission?
That's a fantastic question, and it's a fantastic question. So yes, this is an area of active research, because we know that people can test positive for COVID-19 using these molecular tests, PCR tests, for quite a long period of time. But that doesn't necessarily mean that they're infectious, that they can transmit the virus to others. From the data that we have seen, there is a difference between mild patients and severe patients. The data is very limited right now. We're working with a number of labs who are testing patients systematically, so regularly testing patients over time, which will allow us to not only see if they're PCR positive, but if they can actually grow virus, which means there's viable virus to transmit to others. What we know so far is from mild patients, there are 3 or 4 studies that have shown that someone can transmit the virus to others for up to 8 days, maybe 9 days, but they don't identify live virus after 9 days or so. There is a difference between severe patients. There's one study, it's in a preprint, and the lab shared these results with us through one of our international networks and teleconferences, actually 2. saying that someone who's more ill, someone who's really severe, we can find live virus from them up to 3 weeks. But those individuals are in hospital and they're isolated. So there is a difference between mild and severe patients, but we're using this information to help us understand how long someone needs to be isolated for contact purposes, to prevent passing it to others. But it's really important that part of this package that we recommend to countries, which we have from the beginning, is that all cases are isolated. We would like cases to be isolated in a medical facility or a special facility so that they don't have the opportunity to pass to others. There are situations where people who are mild, who don't have underlying risk factors, who are under 60 years old, who can be cared for at home if they're infected. But again, if the virus is in the home, then we have to make sure that they don't pass it to other people. So it's really, really important that all cases are identified, even asymptomatic cases, because they can also pass the virus to others.
Thank you very much, Maria. Here is the next question coming from LinkedIn. How will I know that I'm COVID negative after I was positive?
You mean after?
Do patients repeat their tests, or how do they confirm they are
that's
negative?
also a very, very good question. So it's linked to the first question that I just answered.
Keep the questions coming.
Yeah, keep them going. You're challenging us, and this is, these are some of the most critical questions right now because all of these recommendations. I will answer the question, but all of these recommendations that we make have implications on how countries manage this. They have implications for where patients are treated, where they are isolated, and they all have not only a health impact but an economic impact as well. In terms of when someone is negative, in the beginning of this pandemic, we recommended repeated testing, and if somebody had to test negative twice, and they had to have 2 negative tests at least 24 hours apart. What we've recently done is use the data that I just described to give other recommendations that are not testing based to say when someone can be released and is no longer infectious. So what we recommend now is for symptomatic patients, they have to have at least 10 days, they need to be isolated for at least 10 days from the time that they develop symptoms, plus an additional 3 days after symptoms resolve. If you are asymptomatic, it's 10 days from the time you test positive. We have guidance on this and we have a visual that's coming out, but it does link back to when someone is infectious. But again, we're still learning. We're still learning a lot about this virus. As new data becomes available, we will incorporate that into our guidance.
Thank you very much, Maria. A few of our viewers on Facebook are asking, is it possible to infect it again with COVID-19 once you already suffered it or not?
Another very good question. So what we expect is, and what we are seeing, is that people who are infected with the SARS-CoV-2 virus, this is the virus that causes COVID-19, they develop a response, an antibody response, which is something that naturally happens after any infection. What we're trying to understand is what this antibody response means in terms of immunity, in terms of protecting them against another infection, how strong that antibody response is, and for how long it lasts. We don't have a full picture of this yet. We do expect that people will have some protection for some time, but again, we don't know how long that will last.
Thank you, Maria. Here's the next question.
We have one for Dr. Mike Ryan here.
There is one, Dr.
Oh, this is good. Keep going. You're on a roll, right?
A Facebook viewer says by name, Dr. Ryan,
there we go.
I am concerned about the concept of herd immunity. Some people believe it is better option. What are your thoughts on this?
Herd immunity is a term that's generally reserved for people who work on vaccination, and because we want to try and understand when we're designing or developing vaccines what proportion of the population do we have to vaccinate in order to stop the disease moving. You don't need to vaccinate everybody, and in that sense I think everyone gets that. If we're sitting in a room and I'm in the middle of the room and everyone around me is vaccinated, then I'm in some senses protected by a wall of people. And if the next person who has the disease is far away from me, then it's going to take a lot for that disease to move towards me. And that's the concept of herd immunity. What proportion of the population do you need to vaccinate in order for that effect? And that's what's called the herd immunity effect. It means, in a sense, that you don't have to be perfect in your vaccination campaign in order to achieve disease control. You get an advantage. And for different diseases, that's at different percentages. So in general, for viral diseases, it's probably somewhere between 60, 70, 80%. For measles, it's higher because it's very infectious. It spreads very easily, and you need a much higher number of people. So herd immunity is essentially the number of people in the population who are immune to the disease. And that's usually achieved by vaccination. This has been somewhat taken into the COVID world, where without the vaccine, people say, well, the number of people who are positive in the community is 5 or 10%. How many people need to be positive in order for us to reach herd immunity? Well, it's a debate. We don't know what that number is. Most scientists will agree that it's somewhere between 60 and 80%. Others would think that it could be lower. And I won't go into the the epidemiologic and mathematical details of it, but there are certainly arguments that it could be a little lower. But whatever that number is, we're nowhere close to it, which means this virus has a long way to burn in our communities before we ever reach that. So the idea that we would have herd immunity as an objective, in some senses, it goes against controlling the disease, because if you were to say, well, we need to have a herd immunity of 70% and we should let the virus spread until we get 70%, we've seen what happens. Hospitals get overwhelmed. A lot of people die. And again, what we don't realize or we don't understand fully yet, and I think it's something we need to understand a lot better, and I say this to younger people online, there is this perception, and it's true, that the vast majority of younger people have a milder version of this disease. But we've seen significant long-term impacts. Yes, they don't die, but we don't fully understand the long-term impacts of this disease. And anyone who's looked at patients who are severe with COVID realize that this is a very severe multi-organ disease that stresses many systems in the body, the cardiovascular system, the neurologic system. And we will have to assume that in milder cases, that similar process may be happening at a milder level. And we don't know what the long-term impacts of that are going to be on people's long-term health. We've seen perfectly healthy young people go to hospital, have a moderate disease, and then come out and find 10, 15 weeks later, they still can't run, they can't exercise, they're out of breath, they're getting coughing fits. Who wants or needs that? So I think we really have to come to grips with, yes, COVID mightn't kill me, but COVID could debilitate you for a significant period of time. And therefore we have to take it seriously. We have to take protecting ourselves and protecting others seriously. I said it, I think, last week. At some level we have the right to potentially risk harm to ourselves. We have no right to risk harm to others. And I think we need to look at that very, very carefully as well.
Thank you, Mike, very much. You mentioned now that COVID may prevent some people or disable some people to go gym and do some sports for some time. We are receiving a lot of questions from several viewers across platforms about going to gym at the moment. Is it safe to go to gyms and exercise? Some countries are reopening gyms. So what is your opinion on that?
I think it's very similar to the arguments that have come up around opening schools or opening other venues. When people mix, as Maria has said, the virus likes people. You put people together in closed environment, particularly where they engage in strenuous activity that may involve them producing droplets, heavy breathing, shouting, whatever else. And in that sense, gyms and have been shown in this outbreak to be associated with higher levels of transmission. But, and I say but, because if there's no disease in the community, then the gym is safe. So everything about these environments like gyms or bars or nightclubs or anything else, the risk of those environments depends entirely on what is the risk in the community at large. And if you've worked together, and if the community have worked together with the government and transmission in the community has been suppressed to very low levels, then going back to the gym is fine. And I think when those risks are low, they still need to be managed. And I believe, for example, many people who run gyms have a lot of knowledge. They're very, very good at managing safety. Gyms are inherently risky places. You're dealing with heavy weights. You're dealing with people who are exercising and stressing their bodies. So people who run and manage gyms are smart people. They know how to manage risk. They manage the environment they're in. They make that environment as safe as possible for their clients. And adding in COVID management is just another safety measure. I do, though, think in areas with intense community transmission, gyms are probably, if I was in that situation, I would probably keep gyms closed. The issue is when communities open up, gyms should open up in the same way, but in a planned and sequential way. But gyms are no more dangerous in a sense than any other environment in which we gather en masse together, and they need to be managed carefully. But again, I believe with proper professionalism and compliance from people who use gyms, they can be made safe.
I think what we're asking, Alex, is for people to take responsibility themselves for the decisions that they make and the actions that they take forward. So as Mike has said, if the virus is not circulating in an area, things are safer to do. If the virus is circulating in an area, then people need to make a decision, and they remain open. Individuals need to make a decision. Do I need to go to that nightclub? Do I need to go to that bar? Do I need to go to that gym? And that needs to be an individual level decision. If the virus is circulating, if there aren't proper measures in place, then perhaps you should skip. There are other ways that you can exercise. It's really important to stay physically fit, and so there's different things that people can do. They can run outside, or they can do an exercise class in their homes, in different ways to keep physically fit. But not only do the owners of these establishments need to take precautions, those who are attending these establishments also need to take responsibility, because it's not only a matter of protecting themselves, it's a matter of, if I go to that gym, if I go to that nightclub, and I happen to get infected, whether it's at the nightclub or it's on the public transport or however it is that you got there, you could bring that virus home. And if it doesn't have an impact on you in terms of a severe disease, you could infect a loved one at home. And they could be a parent, they could be a grandparent, they could be somebody who has an underlying condition, and that can have a much stronger and more severe effect on them. So we need people to really take responsibility and know what their individual risk is.
Thank you very much, both. This reminds me as well that later this week, Muslim populations will gather to celebrate Eid. What is WHO recommendation for such religious and social gatherings?
Yeah, so this is a great question. And so Friday, people will come together and celebrate Eid, which is wonderful. What we do for all events is we recommend that a risk-based approach is taken, which means you ask a number of questions, in terms of how the event is held. Is it held indoors? Can it be held outdoors? Can it be held virtually? I know many people who are having celebrations, family celebrations, religious celebrations, have been doing these over Zoom, over different types of different platforms, if that's available. They've been having them outside. There's some fundamentals that need to be taken into account. It's physical distancing, limiting the size, limiting the duration of the event if they are decided to take place, making sure that there's good hand hygiene, appropriate food preparation, and food safety that's taken into consideration. There's really no reason that people cannot continue to celebrate religious events and family events. We just need them to be done in a safe manner, and there's ways in which that can be done. Again, this is a challenging time for many people, but we are finding people be very creative in the ways that they continue to socialize with one another. So we do have guidance out specifically on Eid, and we're grateful for our colleagues in EMRO who've led that. But Eid is a celebration that will continue, and we've just outlined some different ways in which that can be done safely.
Thank you very much, Maria. Before we close, because we are running out of time for today, Dr. Mike, here is a question as well for you, coming from several viewers, about the second wave of this pandemic in countries or communities that have success in suppressing this virus.
Mm-hmm. Yeah, there's a lot of talk at the moment. People are saying second wave, second peak, and because there has been this perception that this disease would behave a little bit like influenza, and it would have a natural peak, and then it would disappear for a while, and then it would come back in the northern hemisphere in the autumn. I think we've always said that we didn't know that, I think what's become clear is that when we move to suppress this virus, we put pressure on the virus. It's like when you push those of you who swim, if you take a ball and you push a ball underwater, if you release pressure from the ball, it jumps up. And I think this virus is behaving like this. It's like a spring. When we push the virus down, we suppress transmission. Release the pressure, it bounces back up. Now, you can call that a second peak, a second wave. You can call it what you like. What it means to me is this virus requires sustained pressure to reduce transmission, and it requires a sustained commitment to reduce exposure. And I think they're the two things we need to do. The government and the authorities need to work to suppress transmission. Stop cases, detect cases, test cases, quarantine contacts, do all of that work, right? And communities and individuals need to do everything they can to reduce their exposure to the virus. And in countries where we've seen well-managed efforts of the part of government to suppress transmission, and where we've seen communities empowered to reduce their exposure, we see success. And we need to see that partnership in countries really improve and really grow. So I would say that there is no second wave as such. What we're seeing is the virus naturally re-emerging when we take pressure off. And when people move around, and countries who have done well have opened up their borders and people start to move, then you start to see flare-ups, we'd call them flare-ups. Now the real question is, how fast do we react to them? And I said this in previous presses. Please don't judge countries and declare failure when all of a sudden there's 2 or 3 clusters in a country after great success. That happens, and that is not a failure on behalf of the country. But please look to what countries do in response to those clusters. And if countries react quickly to the cluster, if they investigate the clusters, if they do localized control measures, and if you can see countries reacting in an agile and rapid and systematic way to new clusters of disease, then I think we're going to get into control again. If you see countries ignoring clusters and allowing the disease to get out of control again, then I think we're going to be into what your viewer has said is a second wave. I mean, all we really mean by a second wave is lots more cases. And we want to avoid that. And I believe it is avoidable. And there are countries demonstrating that you can put this virus back in the box again and again and again, but it takes a huge and sustained effort. And nobody understands more than us how exhausting that is for everybody. I think this is something after 7 months we do need to take into account. Everyone is tired. You know, people are just tired of not having their normal lives. People are afraid because now it's 6 months. My kids aren't in school, and how long is my unemployment going to last, or will my employer still keep me on? So this second wave of anxiety too, as people look at the long-term potential for this virus to stick around. I do think, and this is where I think in a crisis, you can either fold and accept your fate and say, well, there's nothing we can do, or you can redouble your efforts and say, look, what we can do things. We need to take control. We need to take action. And I think we need every single individual, every single community. And I would love to see young people do this. I challenge young people out there. Take control. Take action. This is your world. This is your future. You have the power. We have the knowledge. We know what to do. And I know it sounds simple, but it's hard to achieve. And I really would say we can avoid the second waves. We can avoid this disease going back up and, destroying our economies again and flooding our hospitals again. But it's going to require each and every person to take control, take action, know your risk, manage your risk, be smart, and make a difference. And never before have we needed the young people of the world to take notice of that and take action.
I thank you very much, Dr. Mike Ryan, Dr. Maria Van Kerkhove, and we thank all our viewers from the UK, France, Canada, Israel, Philippines, Serbia, Paraguay, the USA, Spain, Denmark, India, Nepal, Pakistan, Vietnam, South Africa, Ghana, Ireland, etc., etc. Numerous viewers from all parts of the world. We will be here back next Wednesday to respond more of your questions. Meanwhile, either visit our website for more information or follow our social media channels where we'll be posting regular updates. Thank you and have a good day and stay safe.